Your knee arthritis is keeping you from doing the things you want to do. It's painful to walk the dog, grocery shop, climb a flight of stairs. You've tried anti-inflammatories, steroid shots, and physical therapy, but nothing seems to help. Knee replacement surgery can ease chronic knee pain, restore function in the joint, and improve movement. It's a common procedure, with more than 600,000 knees replaced in the United States each year. Before surgery, you'll be encouraged to watch a series of instructional videos and review educational materials. You will also need to attend a preoperative class at a UPMC hospital. Next, there's prehab. You'll work with a physical therapist to improve the strength and motion of your damaged knee. If your overall health is not optimal, we will work with you to make improvements that also minimize surgery risks. In a knee replacement, an orthopedic surgeon removes the damaged bone and cartilage in the knee and then resurfaces that damaged bone and cartilage with a combination of metal alloys, plastics, and ceramics. Thanks to advancements in technology, today's implants are more durable, offer greater flexibility, and last longer. They also come in a wide range of sizes to assure a customized fit. After surgery, you'll be given antibiotics and pain medicine. Therapy starts that day. You'll be up and walking the same day using an assistive device that is appropriate for you. Initial therapy is the most challenging part of the recovery. You should anticipate 6 to 8 weeks of physical therapy in routine cases. Further exercising and strengthening may be necessary to return to high-level activities. If you do the work, you'll recover more quickly and prevent future injury. Staying active and controlling your weight are the best ways to aid your recovery and keep your knee strong. Your new artificial knee should allow you to get back to your daily activities like golfing, bowling, swimming, and biking. Brought to you by the experts at UPMC Orthopedic Care.